Previously, we have gone through medical term structures. Now, we are starting with the basics of every medical profession, anatomy. Among an ocean of concepts and terms within the human body, where do I start? Here is what I would do. Identify and categorize systems for available physiotherapy treatment. Start with major structures in the system and gradually increase understanding by knowing more smaller muscles. Finally, I would practice or discuss with colleagues and classmates to fortify the knowledge. Have a think, what service do physiotherapists offer? What makes us different from other healthcare professionals? More importantly, what problem can we solve? There are 4 major systems physiotherapists get involved with. We have the musculoskeletal systems where mostly acute or prolonged mechanical injury is treated. Specialized areas such as pelvic health is a major concern over recent years and can be treated with physiotherapy interventions. Not only that, physiotherapists treat a wide range of neurological conditions with a main goal for maintaining degenerative conditions. Conditions such as functional neurological disorder and motor neuron disease requires long-term care from physiotherapists. It is also a physiotherapist's job to manage patients with cardiorespiratory issues. Problems range from experiencing COPD to post-laparotomy surgery. Events where patients will experience changes in blood pressure, oxygen saturations, or even at risk of respiratory failure. There will be specialized physiotherapists to support you. Even though this system might get less attention, physiotherapists also have treatments for treating peripheral vestibular issues, such as vestibular hypofunction and benign paroxysmal positional vertigo, aka BPPV, causing patients to feel sick and possible risk of falls leading to an inability to self-care. So how does understanding those help me? We give an example from musculoskeletal cases, one of the common cases faced by many elderly, knee osteoarthritis. To treat this issue, we need to know which particular knee structure is damaged. Knee osteoarthritis is a degenerative joint disease, a product of wear and tear over time. Knee OA happens when the cartilage in your knee joint breaks down, causing the bones to rub together. To treat this, we need to maintain the range of movement and strength of the knee to prevent it from exacerbating. Beside training the quadriceps and hamstrings, we can also strengthen hip muscles and ankle muscles to relieve the stress on the knee by ensuring the muscles stay active. As you can see, joints and muscles interbenefit with each other. By using the conditions physiotherapists are treating as a baseline, we can review the anatomy at length with the sole purpose of treating the patient for that specific condition. The learnt anatomy will then benefit the thought process when treating knee-related injuries. This is just an example of how I would start to revise anatomy, as this would pique my interest and understand why we study anatomy, not just for the sake of memorization but for treating patients with a specific problem. By using conditions or treatment methods as a foundation, we can start systematically. We can also feel a sense of achievement since we know we can treat that specific group of patients through our learning. I hope this brings a new perspective into anatomy studying. That's it for today. We'll be keeping ourselves updated next week.